Hi, so this is for discussion number 6. For chapter 1, the first key idea I had was number 1, which said practices and values of modern medicine have their foundation in the social and intellectual context of the mid-19th century. So this was in the 1800s, and American doctors and doctors in training were studying in Europe. And in Europe, there was European Enlightenment that was going on, which was, the author described it as a pattern of cultural values that were evolving. And so what was starting to happen in the medical field was that the doctors were emphasizing that they wanted to address the whole of mankind. So I think that's something that we can see today in our healthcare field, is that we want to treat the whole patient and the whole person and not just the disease that they have. And the author said that these attitudes and values were manifested in medicine as observation of patients, written recordings of observations, which today would be our charting, so they started that even all the way back to the 1800s. Appreciation of the patient's story and case-based clinical training. So I think these are all things that we can see today in our medical and healthcare field, and they were all the way back to the 1800s were really setting the foundations for how our healthcare system was going to be. The next key idea I had was for chapter 1 was number 5, which said this 17th century paradigm evolved into the dominant system of thought that propelled future medical scientists and physicians to act as objective observers, striving to eliminate subjective features of their practices. So this was a couple hundred years before the mid-19th century that I was just talking about. And so during this time, philosophers were doing a lot of thinking, and this was called the Age of Reason. So they were really looking to, discover things based on logic. And one of these philosophers, Bacon, thought he found the method to discovering truth through empirical observation, analysis of observed data, logical inference resulting in hypotheses, and verification of these hypotheses through continued observation and experiments. So earlier, I think, before we were really addressing the whole patient, they thought that everything could be solved through logic. So this was starting, scientists and physicians to discover, just do experiments, figure out what's going wrong, figure out how to fix it, and you can fix it all based on science and based on fact. And this isn't taking into consideration the person or subjectiveness of, the patients and the humanity of the people treating them. Okay, moving on to chapter 2. I had a key idea number 1, which said stories are a universal way of giving meaning to experience. And I think this is a really interesting thing to discuss. And I agree with this, and I think that you as a person, stories really, and telling these stories give you a way to reflect on what you've experienced. So even though you're describing it to someone else, you get to reflect on it too and just kind of get a better understanding of who you are and why you are who you are. And the author said that stories are a primary way in which we understand ourselves and the world we inhabit, and they are a primary means of influencing others. So I think that's interesting, because as we're telling stories about ourselves and what we've experienced, is that these can also affect others and give them things to think about and help them realize what you have been through as a person. And I think it's interesting to think, because stories are if it's written down, it's words, but especially I like stories, person to person, because stories are so much more than just words. There's emotion to it also. And so I think this is something we can keep in mind working in healthcare, because we can listen to our patients' stories and figure out who they are as a person. And then we can also apply this to the people we work with, because we don't know what they're going through, but if we listen to what they have to say, we can really learn who we're working with and develop a new level of trust with them.